Today, we're diving into something really important, a new way of thinking about cancer care for people with lung cancer. It goes way beyond just treating the disease. We're talking about functional recovery, which is really a plan for getting back the strength and the spirit to fully live the life you love, both during and after treatment.
Think about it for a second. When someone gets a serious diagnosis, all the focus, understandably, goes straight to the medical stuff. But the ripple effect is so much bigger than that. And it really makes you ask a fundamental question. How does this whole journey truly change a person's life?
Well, the research is pretty clear on this. For a lot of people, it brings on some major functional limitations. And we're not just talking about feeling tired. This is about a real, reduced ability to work, to hang out with your family, or just enjoy the things that make you you. It's a challenge that can affect the very core of who we are.
Okay, so what can we actually do about it? For a long time, the path wasn't super clear, but that is definitely changing. We're about to walk through a massive scientific effort to build a real, evidence-based roadmap for both patients and their doctors.
So our guide for this journey is something called a clinical practice guideline, or a CPG. The best way to think about it is like the ultimate playbook. This isn't just one person's opinion, nope. It's a super rigorous look at all the best research out there, all boiled down to create clear, trustworthy recommendations. And when I say rigorous, I am not kidding. To build this guideline, a whole team of experts sifted through years and years of research. They analyzed 54 high-quality clinical trials. That is a huge amount of data, all brought together to figure out what truly helps.
The researchers were incredibly smart about this. They broke the whole cancer journey down into these 4 distinct phases. By doing this, they could see exactly which strategies work best at specific times. From the moment someone is diagnosed all the way into long-term survivorship.
All right, so let's get to the good stuff. What did all this research actually find? Well, across all that data, one foundational idea stood out, time and time again, as the absolute cornerstone for helping people get their physical strength back.
And here it is. The single biggest, most powerful recommendation for improving physical function was a combo approach to exercise. So that means mixing things like walking or cycling, your aerobic stuff, with either strength training or some specialized breathing exercises. Now, what's really cool is how clearly this chart shows the results. Study after study found that the patients who were in the exercise groups saw huge, meaningful improvements in things like walking tests. Meanwhile, the groups that didn't exercise, they saw almost no change. This isn't just a small effect, it's an absolute game changer for physical recovery. But remember, we started this by saying that recovery is about so much more than just the body. It's about getting your whole life back. And guess what? The researchers looked at that too, going beyond just physical numbers and into the world of our social well-being. And I think this slide just brilliantly shows the difference they were looking at. On one side, you've got physical function, being able to move around and take care of yourself. But on the other, you have social function, which is your ability to actually participate in your life. That's a crucial difference because you can't really have a high quality of life without both. So what helps with that social side? Well, as researchers were looking at different interventions, one particularly surprising finding popped up, and it might not be what you'd expect. They pointed to this one key study from 2019. The team was looking at an intervention designed to help not just patients, but also their caregivers manage all the stress of treatment and just improve their overall well-being. And the intervention they tested wasn't your typical rehab program. It was a specialized yoga program, one designed for patients and their caregivers to actually do together. It focused on things like gentle movement, breathing, and meditation. So what happened? The results were crystal clear. It worked. The study found a direct, measurable improvement in the social function scores for the patients who were in the yoga program. This wasn't just them saying they felt better. This was a real, statistically significant outcome. And here is the number that proves it. On a standardized scale they use for this stuff, the yoga group saw their social function scores jump by 6.2 points. This gives us some really concrete evidence that a practice like yoga can have a real positive impact on a person's ability to connect with the world during a really tough time. And get this, it wasn't an isolated finding. The guideline also pointed to other studies, like one from 2016, which found that holistic supportive care sessions, ones that address psychological, social, and even spiritual needs, also led to big improvements in social function. Okay, so let's zoom back out and put all these pieces together. We've got physical exercise boosting our mobility, and then we have practices like yoga and supportive care boosting our social well-being. What does this all mean when you look at the big picture? The big takeaway message is this: the most effective path to recovery is a holistic one. It's not just about healing the body. Real, true rehabilitation happens when you combine physical therapy with support for a person's social and emotional health. It's all about caring for the whole person.
And that really leaves us with a powerful final thought, doesn't it? All of this research points toward a future where the goal of cancer care isn't just about survival, it's about giving people the tools they need, everything from exercise to yoga to supportive counseling, to truly, genuinely thrive and live their absolute fullest lives.